I'm Dr. Pramod Krishnan, consultant neurologist and epileptologist at Manipal Hospital, Bangalore. Today I will talk about a few common misunderstandings or misconceptions about epilepsy. So one common thing I hear people say is, no one in our family has ever had epilepsy before. So epilepsy is not always a genetic condition. Only a small number of patients have a family history. For most of them, there is no family history of epilepsy, so that is not necessary. The second point I hear from many patients is, he never had epilepsy all these years. How can it start now in his 40s or 50s? Remember, epilepsy can start at any age, starting from few days after birth to the first seizure may happen when a person is celebrating his 100th birthday. So there is no age barrier for epilepsy at all. Only the causes would differ, but epilepsy could happen at any age. Another important myth is that epilepsy is caused by lack of sleep, stress, and such lifestyle factors. These are not causes, these are triggers for epilepsy. There must be an underlying condition in the brain that causes epilepsy. These lifestyle factors only trigger it. So they are triggers and not the causes. Another misconception is that once you start treatment for epilepsy, you need to be taking it for the rest of your lives. That is not true for all epilepsy. In many epilepsy patients, if they are well controlled, doctors would consider stopping the medicine after 2 to 3 years. Yes, there are patients who require medications for prolonged period of time and even lifelong, but that is not the rule. There is also misconception that certain food items can trigger epilepsy. This has not been proven by any proper scientific studies. So as epileptologists, we do not insist on any particular foodstuff being given more or less in people with epilepsy. All we tell them is to have their food on time. There are some recent advances in the treatment of epilepsy that most people are not aware of. Apart from medications, epilepsy surgery is also becoming a rapidly developing field in the treatment of epilepsy. Any patient who is using 2 or more medications and still has seizures should consider the possibility of epilepsy surgery as a treatment option. You should discuss this with your treating doctor, who will guide you and educate you about this possibility. There are many patients who have successfully overcome epilepsy through epilepsy surgery. For those who cannot go for epilepsy surgery and who are not doing well with medicines, there are certain other treatments called vagus nerve stimulation and deep brain stimulation, which are very effective in epilepsy treatment. Thank you.